Welcome to Bugs and Beyond Podcast, your one-stop shop for everything infectious diseases. Before we jump into today's deep dive, let's take a quick pause and tap into a bit of gratitude. Studies show that feeling grateful can actually boost our learning. What's one thing you're thankful for right now? It could be something simple, like a warm cup of tea or a favorite song, even just the fact that you're taking the time to learn something new. Okay, hold on to that feeling for just a moment. Feeling good. Great. Let's dive into the fascinating world of community-acquired pneumonia, or CAP for short. We've got a stack of research and guidelines here, ready to extract the most important nuggets of knowledge just for you.
It's amazing how much there is to learn about pneumonia, especially when you realize it's not just one condition, but an umbrella term for any acute infection of the lungs. And there are different types, each with their own quirks.
So today we're focusing on CAP, the kind you pick up out in the world, not in a hospital setting. Why is understanding CAP so important?
Because it's incredibly common and can be quite serious. We're talking about roughly 5 million cases in the U.S. each year, with 1.5 million of those landing people in the hospital. And for those over 65, it's actually the 8th leading cause of death.
Wow, those numbers are definitely eye-opening. So it's not just a little cough and sniffles, huh? This means we're all potentially at risk, right?
Well, some people are definitely more vulnerable than others. Age plays a big role, with young children under 5 and adults over 65 being more susceptible. But it's not just age. Think of anything that might compromise your body's defenses, things like chronic conditions like COPD, heart disease, or diabetes. Smoking also weakens the lungs. And of course, a suppressed immune system from medications or other health issues makes you more vulnerable.
So it's all about how strong your immune system is in fending off those pesky bugs.
Exactly. And here's something that might surprise you. Even a simple viral respiratory tract infection like a common cold or the flu can increase your risk of developing CAP. It's like your defenses are already weakened from fighting one battle, making it easier for the pneumonia-causing bacteria to launch a sneak attack.
That's a good reminder to be extra careful during cold and flu season. Okay, so we know who's at risk, but who are the microscopic villains causing all this trouble?
Well, there are the usual suspects. Bacteria like Streptococcus pneumonia, often called strep pneumo, Haemophilus influenza, or H. flu, and Mycoplasma pneumonia. We also have a group we call atypical bacteria.
Atypical. What makes them so different?
These bacteria are harder to identify because they don't show up on a gram stain, which is a common lab test. And here's the kicker. They're naturally resistant to some antibiotics, making them tougher to treat.
Okay, now those are starting to sound like supervillains. Are we talking about antibiotic resistance here?
We are, and it's a growing concern. But before we delve into that, let's highlight a positive development. Vaccination has been incredibly successful in reducing cases of strep pneumo.
That's fantastic news. Vaccines really are the superheroes of public health.
Absolutely. However, the landscape has shifted since the pandemic. COVID-19 has become another significant cause of CAP as it can wreak havoc on the respiratory system.
That's not surprising, considering how COVID can attack the lungs. So, back to those tougher-to-treat bugs. What factors make it more likely for someone to encounter them?
Recent antibiotic use is a big one. It can disrupt the balance of bacteria in your body, allowing resistant strains to flourish. Sadly, alcoholism also plays a role. And as we mentioned earlier, chronic diseases can weaken the immune system, giving these tougher bugs a foothold.
And what about those infamous MRSA and Pseudomonas aeruginosa I keep hearing about? Are those in the supervillain category too?
Yeah, those are definitely heavy hitters, especially in hospital settings. MRSA, or methicillin-resistant Staphylococcus aureus, is a strain of staph that's resistant to many common antibiotics. Pseudomonas aeruginosa is another tough one, often lurking in hospital environments. They can cause serious infections, especially in those with weakened immune systems.
This is all pretty sobering. Our bodies have these amazing defense systems, but how do these pathogens even manage to invade our lungs in the first place?
It's a constant battle between our defenses and these invading pathogens. Often these microbes are just hanging out in our nasopharynx, the area at the back of our nose and throat. When our defenses are down, they seize the opportunity to sneak down into the lungs, causing infection.
It's like a microscopic Trojan horse scenario, right?
That's a great analogy. Think of our respiratory system as a fortress with multiple layers of defense. We've got nasal hair and turbinates acting like filters, and the shape of our upper airway helps trap particles. Then there's the mucociliary apparatus, which is like a conveyor belt of mucus, sweeping invaders away.
Wow, our bodies are amazing. What other defenses do we have?
In the oropharynx, the back of your throat saliva helps wash away pathogens, and the cells lining the surface are constantly shedding, taking microbes with them. Further down in the trachea and bronchi, we have the powerful cough reflex and more mucociliary action. And finally, in the alveoli, those tiny air sacs in the lungs, we have alveolar lining fluid, signaling molecules called cytokines, and our mighty alveolar macrophages.
Macrophages, those sound pretty tough.
They are. Macrophages are like the Pac-Man of the immune system, engulfing and destroying bacteria. We also have polymorphonuclear cells, another type of white blood cell that helps fight infection.
It's like a microscopic army defending our lungs.
Yeah.
But what happens when these defenses fail? How would we even know we have CAP?
Well, the signs can be pretty clear. You'll likely experience the classic symptoms: cough, shortness of breath, chest pain, fever, and fatigue.
That sounds pretty miserable.
It can be. And the severity can range from mild to life-threatening. During a physical exam, a doctor will listen to your lungs for clues like crackles, wheezing, or decreased breath sounds. They'll also check your oxygen saturation, which can be low if your lungs aren't functioning properly.
So listening to the lungs and checking oxygen levels are key. What about lab tests? Can they help pinpoint the exact culprit?
Absolutely. Blood tests can reveal leukocytosis, which means an elevated white blood cell count, indicating infection. Sometimes we even see leukopenia, a low white blood cell count, which can signal a more serious infection. We can also check inflammatory markers like ESR, CRP, and procalcitonin, all of which are elevated during an inflammatory response. And to identify the specific pathogen causing the pneumonia, we can do microbiological testing.
Like what? Give us the rundown.
We can take blood cultures, sputum cultures, urine antigen tests, and even use rapid diagnostic tests like respiratory viral panels to quickly identify viruses.
So armed with all this information, how do doctors decide if someone needs to be hospitalized for CAP? It seems like there's a lot to consider.
There is. And that's where tools like the CURB-65 score come in. It helps us gauge the severity of the pneumonia and figure out the appropriate level of care. Think of it as a quick snapshot of how serious the situation is.
CURB-65. What does that stand for?
It stands for confusion, uremia, respiratory rate, blood pressure, and age 65 or older. Each of these factors gets a point if it's present. Based on the total score, we can classify patients into risk groups and decide if they need outpatient treatment, hospital admission, or even intensive care. For example, a score of 0 or 1 suggests low risk, and outpatient treatment might be fine. But a score of 3 or higher indicates higher risk, and we'd usually recommend hospitalization.
So it's a quick and easy way to assess the severity, kind of like a triage system.
Exactly.
What about kids? Is there a similar scoring system for them?
Unfortunately, there isn't a validated scoring tool specifically for children. We use different criteria to assess their severity, considering things like their age, respiratory rate, oxygen levels, and overall how they look clinically.
So once the severity is determined, what are the treatment strategies for CAP? It seems like there are so many variables at play.
You're right, it's not a one-size-fits-all approach. The treatment hinges on 2 key questions. How sick is the patient? And are drug-resistant pathogens a concern? It's all about personalized medicine, tailoring the treatment to each individual patient.
Okay, so walk us through this treatment algorithm. What are the different antibiotic options for someone being treated as an outpatient versus someone in the hospital?
For outpatients, we often start with a beta-lactam antibiotic like amoxicillin. It's effective against a wide range of bacteria, including our usual suspect strep pneumo.
That makes sense, hitting those common culprits right off the bat. But what if those sneaky atypical bacteria are involved? Do we change tactics?
Absolutely. If we suspect atypical bacteria, or if the patient has certain risk factors like COPD, heart failure, liver, or kidney disease, or has recently taken antibiotics, we might add a macrolide like azithromycin or clarithromycin. Doxycycline, a tetracycline antibiotic, is also an option, as long as we know that strep pneumo isn't resistant to it in your area.
So it's like customizing the treatment plan based on the patient's unique situation and what we know about local resistance patterns. Kind of like a detective piecing together clues, right?
Exactly. And if a patient has taken antibiotics in the past 3 to 6 months, or has other conditions like diabetes, alcoholism, or a suppressed immune system, we might opt for a combination of amoxicillin clavulanate, a broader spectrum beta-lactam, along with either a macrolide or doxycycline.
So it's like bringing in reinforcements, just in case those bacteria are trying to put up a fight.
Precisely. And in some cases, we might even go straight for a respiratory fluoroquinolone, especially if there's a high risk of drug-resistant strep pneumo.
Okay, so for outpatients, we're starting with a beta-lactam and then adjusting based on those individual clues and the local resistance landscape. What about for inpatients? How does the approach change when someone is sick enough to be hospitalized?
Inpatient treatment tends to be more complex. We're dealing with a sicker patient overall, and the risk of drug-resistant pathogens is higher, so we often use intravenous antibiotics delivered directly into the bloodstream for faster and more potent action.
So we're bringing out the big guns.
You could say that. Common choices include ceftriaxone, a third-generation cephalosporin, or ceftaroline, a newer cephalosporin that can tackle MRSA. We might also use ampicillin-sulbactam, a combination beta-lactam, particularly for patients who might have aspiration pneumonia.
Aspiration pneumonia, that sounds a little scary. What exactly is that?
It's a type of pneumonia that develops when you accidentally inhale food, liquid, or vomit into your lungs.
Yikes, that doesn't sound pleasant at all.
It's not. And it's more common in people who have difficulty swallowing or those who are unconscious.
Okay, back to the antibiotics. If those tougher bugs like MRSA or Pseudomonas are lurking, do we need to call in even more specialized forces?
Absolutely. If MRSA is a concern, we'll add an anti-MRSA agent like vancomycin or linezolid to the regimen, along with the anti-pneumococcal beta-lactam and the macrolide or doxycycline.
So it's all about layering the defenses to cover all the bases.
You got it. And for Pseudomonas, we'll bring in the heavy hitters. Anti-Pseudomonal beta-lactams like cefepime, meropenem, or piperacillin tazobactam, along with an anti-Pseudomonal fluoroquinolone like levofloxacin or ciprofloxacin.
Double the trouble, double the antibiotics.
You could say that. And if the patient is at risk for both MRSA and Pseudomonas, we combine all three approaches. It's like deploying a full-scale antimicrobial army.
Wow, that's a lot of firepower. So it sounds like the antibiotic choice is a balancing act, weighing the risk of these resistant pathogens against the patient's individual situation.
Precisely. And remember, we're always monitoring the patient's response to treatment and making adjustments as needed. It's not a static process.
Okay, I'm starting to see the complexity here. So for inpatients, whether they're in the ICU or not, it's about assessing those risk factors, the likely pathogens, and tailoring the treatment accordingly.
Exactly. And this is just a general overview. The specific antibiotics and treatment duration are always determined based on the individual patient's clinical picture, their medical history, and what we know about local resistance patterns. It's like solving a puzzle, putting all the pieces together to get the complete picture.
That's a great analogy. It's not just a one-size-fits-all approach. It's personalized medicine in action. Okay, we've covered a lot of ground on antibiotics, but is that the whole story? What else is important to consider when managing a patient with pneumonia?
You're right. Antibiotics are just one part of the puzzle. Supportive care is also crucial. This includes ensuring adequate oxygenation, managing fever and pain, and providing fluids and nutrition as needed. We're not just trying to kill the bacteria, we're supporting the body's overall recovery.
So it's a holistic approach, looking at the whole patient, not just the infection.
Exactly. We also need to address any underlying conditions that might have contributed to the pneumonia in the first place, such as COPD or heart failure.
That makes perfect sense. And what about monitoring? How do we know if the treatment is actually working and the patient is on the road to recovery?
Monitoring is absolutely crucial. We closely track the patient's vital signs: temperature, heart rate, respiratory rate, blood pressure, and oxygen saturation. We're looking for those signs that the infection is resolving and the patient is improving: a decrease in fever, heart rate, and respiratory rate, a stable blood pressure, improved oxygen saturation, and of course, a clear and alert mental state. We also want to make sure they're able to eat and drink properly, which tells us their body is getting the nourishment it needs to heal.
So we're looking at the whole picture, not just the numbers on a chart.
Precisely. We're treating the patient as a whole person, not just the infection.
This has been a fantastic deep dive into the complexities of pneumonia treatment. It's amazing how much there is to consider, from the specific antibiotics to the supportive care and close monitoring.
It's a multifaceted approach, but the goal is always the same: to help patients recover fully and get back to their lives.
Well said. Now, before we move on, let's switch gears and talk about something that's often overlooked but incredibly important: the duration of antibiotic treatment. How long do people typically need to take these medications for pneumonia?
That's a great question, and it's one that we get asked a lot. The duration can vary depending on several factors: the severity of the infection, the specific bacteria causing it, the patient's overall health, and how well they're responding to treatment. There's no one-size-fits-all answer.
So it's another piece of the personalized medicine puzzle. But are there any general guidelines?
Absolutely. For most cases of uncomplicated pneumonia in adults, the minimum recommended duration is 5 days.
And for children?
For kids, the typical treatment duration is a bit longer, usually 7 to 10 days.
So kids usually need a longer course of antibiotics to completely clear the infection. But you mentioned that these are just general guidelines. What are the key factors that determine when it's actually safe to stop antibiotics? I imagine stopping too early could be a problem, right?
You're exactly right. Stopping antibiotics prematurely can be dangerous. It can lead to a resurgence of the infection. And even worse, it can contribute to the development of antibiotic resistance, making future infections harder to treat. So we monitor patients very carefully and look for several signs that the infection is truly resolving and they're on the mend.
Okay, so what are those signs? What are you looking for specifically?
First and foremost, we want to see the fever completely gone. Ideally, their temperature should be below 100 degrees Fahrenheit for at least 24 hours without using any fever-reducing medications. No more chills or sweats.
That makes sense. Fever's our body's way of fighting infection, so if it's gone, that's a good sign. What else?
Their heart rate should return to normal, usually below 100 beats per minute. Their breathing should also improve, with a respiratory rate below 24 breaths per minute. And their blood pressure should stabilize within a healthy range, with a systolic blood pressure of at least 90 millimeters of mercury.
So all their vital signs should be trending in the right direction, showing that their body is winning the battle against the infection.
Exactly. We also check their oxygen saturation, which should be 90% or higher, indicating their body is getting enough oxygen. And beyond just the numbers, we assess their mental status. They should be alert, oriented, and thinking clearly without any confusion or delirium.
So we're looking at their cognitive function as well, making sure their brain is recovering along with the rest of their body.
Precisely. And finally, we want to see that they're able to eat and drink properly. This tells us their body is getting the nutrition it needs to heal and regain strength.
So it's a holistic approach, taking into account all aspects of their recovery, not just whether the infection is gone.
You got it. We're treating the whole patient, not just the disease.
This discussion about treatment duration has been incredibly helpful. It really highlights the importance of following your doctor's instructions and not stopping antibiotics prematurely, even if you start feeling better.
Absolutely. Completing the full course of antibiotics is crucial for a complete recovery and to prevent those pesky antibiotic-resistant bacteria from gaining a foothold.
Okay, so we've talked about the antibiotics, the supportive care, and how long treatment typically lasts. What about monitoring? How do doctors make sure patients are responding to treatment and watch out for any potential complications?
That's another great question, and it's a vital part of pneumonia care. Monitoring involves a combination of clinical assessments, lab tests, and imaging studies. It's a multifaceted approach to make sure we're staying on top of the situation.
So it's like having multiple sets of eyes on the patient, watching for any signs of trouble.
Exactly. Let's start with the clinical assessments. The most basic form of monitoring involves regularly checking the patient's vital signs: temperature, heart rate, respiratory rate, blood pressure, and oxygen saturation. We're looking for any signs of worsening infection or a decline in their condition.
So those vital signs are like our early warning system.
Precisely. We also pay close attention to their overall clinical appearance. Are they alert and oriented? Are they showing signs of distress? Are they able to eat and drink? It's not just about the numbers. It's about observing the whole patient.
So it's like being a detective, looking for subtle clues that might point to a problem.
That's a great way to put it. We also listen to their lungs with a stethoscope, checking for any changes in breath sounds like crackles, wheezes, or decreased breath sounds. These sounds can tell us if there's fluid buildup or inflammation in the lungs.
So it's like listening to the story the lungs are telling us.
Exactly. And in addition to these clinical assessments, we often order laboratory tests to monitor the patient's response to treatment and assess their overall health.
What kind of lab tests are we talking about?
One of the most common is a complete blood count, or CBC. This test measures the number of red blood cells, white blood cells, and platelets in the blood. The white blood cell count, in particular, can be very helpful in monitoring the infection. An elevated white blood cell count, or leukocytosis, suggests that the body is still fighting the infection. As the infection resolves, the white blood cell count should start to come down.
So a decreasing white blood cell count is a good sign, a signal that the body is winning the battle.
You got it. We might also order a basic metabolic panel, or BMP, to assess the patient's kidney function and electrolyte levels.
Why is kidney function so important in pneumonia?
Kidney function can be affected by pneumonia, especially in severe cases. The infection can cause inflammation and damage to the kidneys, leading to acute kidney injury, which can be a serious complication.
So monitoring kidney function is crucial to catch any potential problems early on.
Exactly. And sometimes we also order blood cultures to pinpoint the specific bacteria causing the pneumonia. This helps us fine-tune the antibiotic treatment for maximum effectiveness.
So blood cultures are like getting a fingerprint of the culprit, helping us choose the right weapon to fight it.
That's a great analogy.
What about imaging studies? Do those play a role in monitoring pneumonia?
Absolutely. The most common imaging study is a chest X-ray. It allows us to visualize the lungs and see the extent of the pneumonia. And we can use X-rays to monitor how the infection is resolving over time.
So chest x-rays are like taking a snapshot of the battlefield, showing us how the infection is progressing or retreating.
Exactly. And in some cases, we might also order a CT scan of the chest. This provides more detailed images of the lungs and can help us identify any complications, like abscesses, empyema, or pleural effusions.
Those sound pretty serious. What exactly are they?
An abscess is a collection of pus that forms within the lung tissue. An empyema is a collection of pus in the pleural space, which is the space between the lungs and the chest wall. And a pleural effusion is a buildup of fluid in that same pleural space.
So these are all potential complications of pneumonia that we need to be on the lookout for.
Exactly. And CT scans can help us detect these complications early on so we can intervene quickly and effectively.
This has been a really thorough look at pneumonia monitoring. It's impressive how many tools doctors have at their disposal to make sure patients are recovering and to catch any potential problems early on.
It's all about being proactive and vigilant. Pneumonia is a serious illness, but with careful monitoring and timely interventions, we can significantly improve outcomes for our patients.
Well said. Okay, so we've covered diagnosis, treatment, and monitoring. What about preventing pneumonia in the first place? Are there things people can do to reduce their risk of getting this infection?
Absolutely. Prevention is always the best medicine. So what can people do to protect themselves from pneumonia? One of the most effective ways to prevent pneumonia is through vaccination. We have vaccines available for two common culprits, Streptococcus pneumonia and influenza.
So getting vaccinated against those two bugs can really lower your risk. Who should get these vaccines?
The pneumococcal vaccine is recommended for all adults 65 and older, and for younger adults with certain medical conditions that weaken their immune system. The flu vaccine is recommended for everyone 6 months of age and older. Getting the flu shot not only protects you from the flu, but also reduces your risk of developing pneumonia as a complication.
So vaccines are like giving your immune system a head start in the fight against these pathogens. What else can people do to stay healthy and avoid pneumonia?
Good hygiene is crucial. Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer if soap and water aren't available.
So good old-fashioned hand washing is still one of the best defenses we have.
It really is. It's also important to cover your mouth and nose when you cough or sneeze, using a tissue or coughing into your elbow. And if you're sick, stay home to avoid spreading germs to others.
So those basic hygiene practices can really make a difference in preventing the spread of pneumonia. What about lifestyle factors? Do those play a role?
Absolutely. Not smoking is one of the most important things you can do to protect your lungs and reduce your risk of pneumonia. Smoking damages those delicate lung tissues, making it easier for bacteria and viruses to take hold.
So quitting smoking is a win-win for your overall health and for preventing pneumonia specifically.
You got it. It's also important to eat a healthy diet, get enough sleep, and exercise regularly. These healthy habits boost your immune system and make you less susceptible to infections in general.
So living a healthy lifestyle is key to preventing all sorts of illnesses, including pneumonia. What about people with underlying medical conditions? Is there anything extra they can do to protect themselves?
People with underlying medical conditions that weaken their immune system, such as diabetes, COPD, or heart disease, should talk to their healthcare provider about additional preventive measures. This might include taking medications to boost their immune system or getting vaccinated against other respiratory infections.
So it's all about working with your doctor to develop a personalized prevention plan. Knowledge is power, and knowing your risk factors can help you take those extra steps to stay healthy.
Exactly. And remember, prevention is always better than cure. Taking steps to reduce your risk of pneumonia is one of the best things you can do to protect your health.
This has been an incredibly informative deep dive into pneumonia. We've covered everything from who's at risk and how it develops, to the complexities of treatment and the importance of monitoring and prevention.
It's been a comprehensive journey, and I hope our listeners feel more knowledgeable and empowered to take charge of their respiratory health.
I agree. So for our listeners out there, what are the key takeaways they should remember about pneumonia?
Here are a few key points to keep in mind. First, pneumonia is serious, and early detection and treatment are crucial if you're experiencing those classic symptoms. Cough, shortness of breath, chest pain, fever, or fatigue. Don't wait. Seek medical attention promptly.
Absolutely. Don't try to tough it out. It's always best to err on the side of caution when it comes to your health.
Second, prevention is key. Vaccination against strep pneumo and influenza can significantly reduce your risk. And simple hygiene practices like frequent hand washing and covering your coughs and sneezes can go a long way in preventing the spread of germs.
Those are great everyday habits that everyone can benefit from, whether they're worried about pneumonia or not.
And finally, if you or a loved one is diagnosed with pneumonia, be an advocate for yourself, ask questions, understand the treatment plan, and don't hesitate to reach out to your healthcare provider if you have any concerns.
That's such an important point. It's your health, and you have the right to be informed and involved in your care. Well, this has been an incredibly insightful deep dive into community-acquired pneumonia. I know I've learned a lot, and I hope our listeners have too.
Me too. It's been a pleasure sharing this information and hopefully empowering our listeners to take control of their respiratory health.
And remember, folks, if you found this deep dive valuable, please like, subscribe, and share it with others who might benefit. We're all in this together, and sharing knowledge is one of the best ways to protect ourselves and our communities.
Well said.
Thanks for joining us on Bugs and Beyond podcast. Until next time, stay healthy and stay curious.